τομέα των βλαστοκυτάρων.
Welcome, Dr. Petz. Thank you for taking time to talk to us. First of all, can you tell us a little bit about what the conference is about here in Cyprus and what you covered in your speech?
Well, the conference was about stem cells and research that's going on now to try to develop therapies for numerous diseases. That's in the field of regenerative medicine. And also then I'll be talking about hematopoietic stem cells, which are used for the therapy of blood disorders in what we used to call bone marrow transplantation, but is now called hematopoietic cell transplantation, because there are three sources of stem cells for transplants. We can get them from the bone marrow, we can get them from peripheral blood, and we can get them from the umbilical cord blood, which is the most recent source of development of hematopoietic stem cells.
What are the current uses of blood stem cells?
They're essentially used for transplantation, so we replace a diseased bone marrow with normal cells. First one treats the patient with high doses of chemotherapy and radiation therapy to destroy a leukemia or other malignant blood disorders, or sometimes a benign disorder that can be very serious, such as sickle cell disease. And then after destroying the diseased bone marrow in the patient, we take the stem cells and introduce them intravenously, and they find their way to the bone marrow and replenish the bone marrow with normal blood cells. So the most common diseases that are treated are leukemias, especially the acute leukemias, which are very severe disorders, and lymphomas, and some immune disorders, and diseases such as sickle cell disease and thalassemia, which are congenital disorders of the blood.
One question which has been asked many, many times, and I know you've heard it before, can you use your own blood cells on your blood stem cells on yourself?
Yes, in fact, the most common type of transplant is what is known as autologous transplant, where one's own cells are used. A good example of that is patients who have lymphomas, where if a transplant is needed, the recommendation is to use autologous stem cells for the transplant. So storing one's own cells has that as one of the possible uses in the future.
Can you outline what the banking of stem cells is?
Well, stem cells are collected from the umbilical cord blood we're talking about now, and then we collect them and test them and type them, and then we store them in the frozen state in liquid nitrogen, and they can be stored indefinitely, and so their usage is available at any time. They can be shipped around the world easily, and from our cord blood bank, for example, we've shipped to practically every continent in the world, and so they're collected and stored in cord blood banks throughout the world.
Now, there is a debate worldwide on whether to bank privately or to donate to public banks. What's your view on this?
Well, public banks are fine, and one serves the whole spectrum of patients who need a cord blood transplant. Private banking, one stores one's own cells, and they can be used for autologous transplants, but it's also true that they can be used for other members of the family who might have a perfect match with that stem cell. So although their usage isn't common, it's certainly a possibility that they will be used.
Where do you get the blood stem cells from, and is there a guarantee that they're safe? Are they screened?
Well, they're screened very carefully, even more carefully than a blood transfusion, and because we screen them not only for all the infectious diseases, but also for congenital disorders, and so that yes, they're quite safe. We don't have any problems in that regard.
Where do you see stem cell development 10 years from now?
10 years from now, I hope that there'll be more transplants done, because at the present time, it's estimated by reliable organizations that there are at least 15,000 patients every year who should have a transplant but don't receive one for one reason or another, in part because some physicians are very restrictive in the patients they would be interested in transplanting, And in part, I think it's because they're